This is Channel 4 Health Bites. Welcome, Dr Prithvi. You are the specialist gastroenterologist at Al Zahra Specialty Hospital, Sharjah. And today we're talking about constipation. Now, for those uninitiated, what exactly is constipation and is it restricted to any particular age group?
Constipation generally means infrequent and difficulty in passing stool. Generally, what we say is less than 3 bowel movements per week, we call it as constipation. But it has to be associated with difficulty and straining while evacuating. But it is not restricted to particular age group. Right from children to adults and old age can present with it. Generally, what is known is about 14% of adults in average has constipation. And what is more alarming is pediatric age group people, about 5% also presents with this constipation.
Now, doctor, what exactly can cause constipation?
There are 3 basic things that can cause constipation. Number 1 would be less fiber in your diet, that is faulty dietary habits, which is accompanied by poor hydration, drinking less water, and lack of exercise. So these are called as external factors which are responsible externally causing it. But when you consider the drugs taken by the patient, like few medicines might also cause constipation, or presence of diabetes, hypothyroid, and all these conditions. And when we talk about internal factors, the movement of the colon or the intestine may be slow. What we call as peristalsis, that itself can cause constipation, and the reasons can be because of the nerves or because of some structures involved which can cause obstruction. So all these can be termed as internal factors that cause constipation. And also we can divide it into anatomical and physiological causes, and this why the cause is important is the treatment of each differs.
And when is it important to contact your doctor? Should it be immediately?
When a patient has a constipation not responding to medicine for over 3 weeks and above, definitely they need to consult a physician. And there are few signs called as red flag signs which cannot be ignored by the person. Like when you see blood in your stools, when there is abdominal mass, you feel something protruding in your abdomen which is palpable. When there is anemia, when the hemoglobin is low, there is iron deficiency. These cannot be ignored. And when the patient starts losing weight, unexplained weight loss, or when the family history of colon cancer, the patient is above 50 years, 60 years, all of a sudden presenting with constipation. All these cannot be ignored and should not be ignored.
Now, doctor, do you need any tests for this?
Definitely. Constipation needs few tests. First of all, when you consult a doctor, it's one-to-one. You speak about the symptoms. Generally, as a doctor, I would like to know your diet history, detailed medical history, any medicines that you're taking, followed by physical examination if required, and then we go ahead with blood and stool testing. And if indicated, if I'm suspecting any obstruction, then I would go ahead with abdominal X-ray. And there is something called as colonoscopy, where a flexible tube would be inserted to examine inside of the rectum and colon. This will be done by a specialized gastroenterologist, and this is indicated when we suspect any masses or ulcers or any obstruction inside the colon causing it. And whenever indicated, we would go in for imaging studies like ultrasound or CT scan as indicated.
And doctor, how can it be treated? Is surgery required?
See, the treatment of constipation, when we talk about it, first it takes time and effort from both the sides, from doctor as well as patient side. First and foremost, the diet has to be counseled. What we have seen is each person takes less than 1/3 the fiber requirement per day. Supposing you require 25 to 35 grams per day of fiber, they'll be taking less than 10 grams, which is very frequently seen. So that has to be adjusted. And when we talk about fiber, it has to be a mix of soluble and insoluble, accompanied by enough water, enough hydration, so that the bulky hard stools itself should not be causing the problem. And when we're telling about fiber, definitely we should include fresh fruits, veggies, and whole grains. And we should not ignore urge to defecate. You have an urge to defecate, don't postpone it. That itself can lead to constipation. And definitely exercise regularly. These are the basic things, followed by we would be adding medicines like bulking agents, fiber supplements, lubricants, laxatives, which can be divided into osmotics and stimulant, that depending on what the causes and how the patient presents with, like stool softeners. Followed by few people would require physical therapy, which requires the muscles has to be involved and the something called as biofeedback mechanism. This again, if indicated in that person. And also, the common thing that has to be changed in a person is the position of sitting while defecating. That will also be trained. And when is surgery indicated? That's a good question. When there is obstructing tumors, polyps, which has to be removed surgically, or nowadays we do few surgeries endoscopically as well. So these, when there is structural causes causing constipation, which is obstructing the movement of the stools, or when the slow-moving colon has failed medical therapy, as in we have given medical therapy to the maximum and it has failed, then only we would go in for a surgery, like outlet problems. Otherwise, most of it would be treated with medicines and with lifestyle modifications.
Doctor, thanks so much for your time today.
Thank you.